Hello, my name is LeAnna McDonald, and today I am going to be discussing infertility with you, focusing on treatment and outcomes. During this presentation, I'm going to give you a brief description of what infertility is. I'm going to discuss treatment and outcomes. There are many factors affecting infertility, and many of the causes are unknown. Male factors, female factors, age, sexual frequency. What infertility is it is the inability to conceive when desired. The strict definition of infertility is that a couple who has regular, unprotected sexual intercourse for 1 year and cannot conceive. There are two different types of infertility. Primary is considered if conception has never occurred, and secondary is when there has been one or more pregnancies before infertility. The definition is usually expanded to couples that conceive and unfortunately have spontaneous abortions. This slide here just shows reasons why women are not getting pregnant and they're not ovulating: male infertility, age, blocked fallopian tubes, endometriosis, underlying medical conditions. Treatment includes medication, surgical procedures, therapeutic insemination, surrogate parenting, bypass obstacles to conception, and assisted reproductive therapy. Medications. Medications may be given to men to improve the semen quality or to the women to induce ovulation and prepare the uterine for endometrium, which is for pregnancy. Or they're just simply given to support the pregnancy after established. Many different medications in combination with other medications are given to mimic the natural functions. Medications are typically continued for 6 to 9 cycles just for the best possible outcome. Medications administered induce ovulation, which also increase your risk for multifetal gestation. Here listed are the most common medications, that is bromocriptine, Clomid, a gonadotropin-releasing hormone, Luprin, menotropin, neferlin, progesterone, Viagra, and HCG, and forgive my pronunciation. Infertility surgical procedures can help to correct many fertility problems and anatomical abnormalities that may lead to infertility or pregnancy loss. Common abnormalities include varicocele, which is enlargement of the veins within the loose bag of the skin that holds the male's testicles, which commonly causes low sperm production and decreases the sperm quality. Adhesions form when scar tissue builds up between the inner walls of the uterus, causing the walls to bind together. Other causes may be from outpatient surgeries that remove tissue, such as prolapse, fibroids, or endometriosis. Tubule obstruction infertility occurs when a blockage in the fallopian tube will not allow the egg and sperm to meet. The condition includes cases of completely blocked fallopian tubes and cases where just one is blocked. Scarring narrows the tubes. Shown here is the most common procedures done for infertility, and this includes a hysteroscopy, which is during a hysteroscopy under general anesthesia, a small hysteroscope is inserted through the cervix and advanced into the uterine cavity. This allows for direct views of the uterine cavity and permits the physician to surgically correct any abnormalities seen. This is a same-day procedure, and the patient typically returns home the next day. Tubule surgery is performed when damaged or blocked fallopian tubes are seen. Laparoscopy, which is a minimally invasive surgery, often requires a few 0.5 centimeter incision through the abdominal wall to view and make surgical corrections to the pelvic structures involved. This can help diagnose endometriosis and remove abnormal tissue and adhesions. Oftentimes, laparoscopy will help the woman conceive on her own without requiring additional fertility treatments. Uterine surgery. When fertility problems affect the uterus, surgery can help to restore your fertility. Uterine surgery can correct blockages in abnormal tissue growth and remove scar tissue and fibroids. Surgery can also repair any abnormally shaped uterus. A surgery called a hysteroscopy may help reducing miscarriage rates and leading to healthy pregnancies. Open abdominal procedures, the most common type of abdominal procedure performed by infertility specialists, is an abdominal myomectomy, which is the removal of large uterine fibroids. Ovarian drilling is a laparoscopic procedure performed under general anesthesia. Ovarian drilling is a surgical procedure that breaks through the ovary's thick outer layer and destroys small portions of it, boosting fertility. Reversal is done when some men and women choose surgical sterilization when a family building is complete. A woman may choose to have her tubal ligation reversed, and a man may choose a vasectomy reversal. These reversals offer many individuals another chance to become parents. Therapeutic insemination, which is also known as artificial insemination, is when the male's partner's sperm or a sperm donor, this sperm is actually placed directly into the uterus. They are washed and treated to improve their chances of fertilizing an egg. Surrogate parenting is another option for those who are having infertility problems. This is when a surrogate mother may donate the use of her uterus only, with the sperm and egg coming from the infertile couple, and they are having a problem carrying a pregnancy. She may be inseminated with a male partner's sperm, supplying both her genetic and her gestational components. Surrogate mothering cannot be anonymous, and the birth mother forms a bond with the fetus during the months of pregnancy. Here I included a video from WebMD that just gives a few tips on ways to bypass the obstacles to infertility. Timing is extremely important in fertility, so I just want you to watch this clip. There are 3 possible outcomes after infertility therapy. Number 1, the achievement of a take-home infant, which is our primary goal. Number 2, unsuccessful therapy resulting in a decision about adoption. And number 3, pregnancy loss after treatment. The achievement of a take-home infant basically is when a couple who had infertility problems are able to have a healthy pregnancy and they give birth to a healthy baby and they're able to take that baby home with no complications. Many couples who have had a hard time becoming pregnant and or have had many spontaneous abortions tend to have that high anxiety. and they may be reluctant to invest emotion into their pregnancy, from the time that they're pregnant throughout the whole pregnancy, just because they fear that something could go wrong. Even when their infant is born, they have this unrealistic expectation as parents, after all of the difficulties it has or they've encountered getting there. Another outcome is adoption. Couples who decide to pursue the adoption must consider their preferences and realities of the children up in adoption. Most couples prefer to adopt an infant of the same race, but that child may not be available for adoption. Some couples fear if they will have that biological child after adoption. They wonder if they'll be able to love the children the same. Another outcome is pregnancy loss. A pregnancy loss after treatment, the couple may feel, have a mixed emotion of optimism and sadness. Some are thankful that they were even able to conceive, and on the other hand, you have some couples who did not result in a successful take-home infant, which discourages them and brings them sadness. Arts are used to assist infertile couples. However, a couple can also use these techniques to avoid known genetic abnormalities carried by one partner. Donors and surrogates involve third parties, and their emotional bonds and legal rights must be considered. Homosexual couples and single people can parent a child through surrogacy, and changed family structure evolves. It is now possible to have 5 parents to a child. You can have a donor egg, a sperm egg, a gestational surrogate, and the parents who will actually rear the child. Here in this slide, you see a table. Basically, what I did here was I summarized everything that we discussed in this presentation. That includes, the therapeutic insemination. I also went into detail to talk about the IVF, the gift, the TET, the ZIFT, a donor egg, a surrogate mother, a gestational surrogate, and the ICSI. I did talk about the terms and descriptions, so it's a very easy table to read. I really do hope that you've learned something today and you've enjoyed this presentation.